Hello, good evening. Tonight we're going to talk about job satisfaction is a predictor of nursing turnover. This is a topic very near and dear to my heart because as a future nurse manager, I want to make sure that we're retaining the top best nurses that we can and make sure we're not losing nurses to other organizations. So some background on nursing turnover. So research suggests that nurses' turnover and tension increased significantly after the COVID-19 pandemic. I'm sure if any peers in this class are nurses, they know that a lot of nurses became very burnt out during COVID, very tired of the long hours, exhausted, tired of wearing PPE, the vaccine mandates. There was a lot of controversy, lots of things that came up during COVID that a lot of nurses just decided it wasn't worth it to be a nurse anymore. Also, the nursing population is aging. A lot of nurses are retiring or switching careers, working from home. Lots of different things play into turnover. Number one thing that I found in my research was nurses described feeling unappreciated. Also, nurses stated that their skills and knowledge were unrecognized by managers in the organization. A lot of times there are incentives to go move to other organizations where they might feel more appreciated, so nurses make the switch and they leave. So how do we keep nurses with our organization? And a big thing that we're learning through organizational psychology is job satisfaction. So job satisfaction by our textbook is described as a positive evaluation of one's job tasks, pay, coworkers, and overall appraisal of one's jobs. So the higher your job satisfaction, the less likely your organization is to have turnover. There's a couple theories that we learn through our text about turnover. The first one is Mobley's turnover model, which describes how job dissatisfaction, thinking of quitting, evaluating options, and then deciding whether to leave play into actually leaving. And then each step kind of represents a decision point where an employee decides what their next step's going to be. So they kind of think, oh, I don't like my job. I'm thinking about quitting. I'm looking at my options. Okay, am I going to leave or not? So that's Mobley's turnover, and I think we've all kind of been through that in a job as adults. Like, we've all been through a job where we're like, okay, do I like it? Thinking about quitting, what are my options? And then you go. The next model, or next theory, is Jakowski's turnover model, which focuses on either taking a different job in the same organization or a different organization. So this model describes job performance as an indirect trigger to feelings of job dissatisfaction or satisfaction. So saying basically, I'm a poor performer at my job. Should I stay with this organization or should I move on? Do a job with a different organization? And I think a lot of people kind of maybe feel this if like their company has very good benefits or a pension, but they're a low performer in that department. Maybe they want to stay with the organization, but maybe move to a different department or unit. So this can come up a lot. And then the final theory that we learned about was Liam Mitchell's unfolding model of turnover, which is used to understand why people unexpectedly just leave. This model states there's 4 paths. So basically a shock or positive or negative can cause people to make the decision to leave or stay. And sometimes there's no shock, just an employee naturally kind of changes emotional response to the organization and they just reassess their commitment if they want to stay or not. And then what are the consequences of turnover? So losing one nurse costs an organization approximately $90,000 to $145,000. That's staggering. So that's more than a nurse's yearly salary. So to lose that nurse costs more than that nurse's actual salary because you're having to hire another nurse, train, orient, and possibly lose that nurse. So that's a big deal, and especially with the finances of healthcare today. Organizations do not want to lose that money. Another thing is the increased cost of contingent staff. So if you don't have any nurses, you're paying travel nurses, you're paying temporary agency nurses who are making quadruple what your staff nurses are making. Also, there's lower levels of work group learning, so you don't have the experienced nurses to train the new nurses coming in. Also, it disturbs hospital services. Increases time in the emergency department, time to get to inpatient beds. It disrupts the whole flow of patient care. Increased rates of in-hospital mortality, higher rates of infection, more patients fall down if you have fewer nurses, less experienced nurses. So predictors of turnover, job satisfaction, organizational commitment, they're negatively related and lead to turnover and tension. So the higher the job satisfaction, the higher the organizational commitment, the more your nurses are going to stay. Also, interesting finding was organizational justice predicts turnover and tension. So the more fair that nurses perceive their work or their employer, the less likely they are to consider leaving. I included this slide. I think it is awesome because it goes through all the factors that kind of drive employee turnover. So we have stress is the highest at 9%. Occupational stress, we've discussed this in class. This is a big deal, especially with nursing. If you're stressed out every day that you go to work, you're probably not going to want to do that job. What was surprising to me, though, is compensation's only 1%. I feel like that would be higher, but I thought that was pretty interesting. Leadership, 5%. Job satisfaction, 5%. You can kind of read through the rest, but very interesting statistics. So what do we do? The way to get started is to quit talking and begin doing. This is my motto in life. Like, let's do something about it. What should we do? So there's a couple of different things that we should do. First of all, cultural change tool. So researching this, I found this recommendation that so an emergency department in Texas decided that they were going to start meaningful recognition, shared decision making, increase leadership involvement and support to try to decrease nursing burnout and stop turnover. And then they used an anticipated turnover scale, an Oldenburg burnout inventory before and after the implementation of the project. And they found that after they started these measures and did this cultural change toolkit, that their burnout was decreased and their turnover was decreased. It was a cheap thing to do, didn't take a lot of money, so that's something that organizations across the U.S. could do. Another thing is self-scheduling. Nurses like to have control of their schedule. So that's why a lot of people will go into nursing. They like 3 12-hour days and have 4 days off. Organizations need to maximize this by allowing nurses to self-schedule. It allows flexibility for family life, for school, for whatever people have going on. Self-scheduling is a big issue that improves job satisfaction. Another thing is support transformational leaders. I was looking through a million research articles that showed that nurses do better when their manager or their leaders higher up are transformational leaders. And then also the research shows that passive avoidant and transactional leadership basically had no effect on increase or decrease on nurse turnover. So transformational leadership, which we just learned about this last week, was a big thing with the nurses, that they appreciate that and they want to see that in their organization. And then the final thing that helps job satisfaction with nurses is nurse residency programs. So when you first come to an organization and you're brand new, maybe a new grad, maybe an experienced nurse, but a nurse residency program improves your success at staying with that organization. I felt this personally. I went through, when I was a new grad, a critical care nurse residency program, and it made me feel like I was more prepared. I was more invested in the organization, and I felt like the organization was invested in me because they had taken the time to make sure that I was set up to do my job well. So these are big things that make people stay with your company. If they know that you're going to invest in them, they want to give that investment back. So just a simple thing that hospitals or different organizations can do to help decrease turnover. And why, of course, we all want to know the what, how, why. So to improve job satisfaction, because these strategies are proven through literature reviews, proven through research, that they improve job satisfaction. The research supports it. Simple, easy things to do. So hopefully they can be done. Here are my references. And if you have any questions, feel free to email me. Email is listed here. And thank you for listening.